Hi, welcome for our presentation about muscular dystrophy. To introduce our case, JF is a 19-year-old male college student. He is immobile and hospitalized for pneumonia. By age 2, he started to assume a lordotic posture while standing. A goer's sign and Trendelenburg gait were noted by the age of 4. By age of 9, he required orthotic braces to assist his walking, and by age of 11, he became wheelchair dependent. He has a long history of progressive weakening of his muscles, most notably in the proximal musculature of the arms, pelvis, and legs. Upper chest, shoulders, and thigh muscles show atrophy, but calf muscles appear to be enlarged. Musculoskeletal exam revealed a scoliotic deformity of the spine. He was diagnosed with Duchenne muscular dystrophy.
So definitions: cardiomyopathy. It is a chronic disease of the heart muscle. Dystrophin. It's a protein associated with X chromosome. Serum creatine kinase. It's an enzyme found in the heart, brain, and the skeletal muscle. Gower sign. A sign for the manner in which children rise to a standing position due to a proximal lower extremity weakness. So, what is muscular dystrophy? Muscular dystrophy is a group of diseases that cause progressive weakness and loss of muscle mass. In muscular dystrophy, abnormal genes, mutations, interfere with the production of proteins needed to form healthy muscle. So, there are 30 types of muscular dystrophies, but the most common type is called Duchenne muscular dystrophy. Prevalence worldwide. In the UK, about 10,000 people are now diagnosed with muscular dystrophy, while in 3,300 males will inherit Duchenne muscular dystrophy. The incidence of Duchenne muscular dystrophy ranges from 10.7 to 27.8 per 100,000. Duchenne muscular dystrophy is 100% fatal. In Canada, one in 1,000 people, typically in male population, has Duchenne muscular dystrophy. About 5,417 people are affected by Duchenne muscular dystrophy.
Etiology: Duchenne muscular dystrophy is a genetic inherited disorder passed on the recessive X chromosome caused by a mutation in the gene that codes the protein dystrophin. Without the reinforcing effect of dystrophin, the sarcolemma tears easily during muscle contraction, causing muscle fibers to rupture and die, leading to severe atrophy and paralysis. Because the mutated gene is on the X chromosome, and males have only one X chromosome, Duchenne muscular dystrophy strikes boys almost exclusively. In relation to JF's family history, it indicates the disease has been inherited, as his younger brother also developed the Duchenne muscular dystrophy symptomatology, and therefore his younger sister will not be affected. As you can see in the diagram, the mother is the carrier of this recessive gene X chromosome. This recessive gene will be passed down to her children, where her daughters will be carriers, while his first son will get muscular dystrophy. And there's a 25 chance that his second son will be affected as well. Pathophysiology. DMD is a progressive neurological condition of the lower motor neurons, causing severe muscular weakness. Without the reinforcing effect of dystrophin, the sarcolemma tears easily during muscle contraction, causing muscle fibers to rupture and die, leading to severe atrophy and paralysis. The proximal musculature of extremities is severely weakened. Symptoms usually appear between the ages of 2 to 4, and by the age of 12, most children are already unable to walk. Enlargement of calf muscles is very characteristic, and later on, the muscle is replaced by adipose and connective tissue. Due to the extreme deterioration of the muscle, or atrophy, loss of movement progresses into paralysis. Respiratory affections and cardiomyopathy are secondary conditions, which usually cause death by the age of 30.
Diagnosis: Mus- muscle biopsy. It looks for abnormal levels of dystrophin in the muscle. Electromyogram. It tests the muscle's response to stimulation of its nerve supply and examines the electrical activity of the muscle. Genetic testing. It tests the mutated genes and health professional also compare family history to diagnose Duchenne muscular dystrophy. Serum creatine kinase testing. It is a type of blood test. It is an enzyme found in the heart, brain, and the skeletal muscle. Skeletal muscle MRI. It diagnoses and monitors the progression of Duchenne muscular dystrophy. Clinical features. JF has scoliotic deformity of the spine, atrophy of upper chest, shoulders, and thigh muscles, and enlargement of calf muscles. Decreased muscle strength and the range of motion of upper extremities. Decreased muscle strength, stretch reflex. Bilateral contractures of upper extremities and the lower extremities. Trendelenburg's gait and the Galver sign.
ICF model in respect to muscular dystrophy. Body structures and function. Bilateral weakness of arms, pelvis, and legs. Bilateral extremities contractures and scoliotic deformity of the spine. Activities. JF will be unable to do self-care tasks, and he will be unable to write, and he will be unable to walk as well. Participation. He will be unable to play with his peers. He will be unable to finish schoolwork, and he will be unable to participate in house chores.
Medical and surgical treatment. So there's no cure available at the moment, but there are still some medication out there that JF can take. So corticosteroids can slow down the loss of muscle strength, anti-congestive medication for cardiomyopathy, and a cardiac transplantation in severe cases. Assisted ventilation can assist in breathing. Surgery for severe contractures in the joints and scoliosis.
Thank you for listening.